नमस्कार। बड़े हर्ष का विषय है कि कंटिन्यूइंग वेटरनरी एजुकेशन प्रोग्राम के अंतर्गत ओरिहील लाइफ साइंसेस कंपनी द्वारा CSR मद के अंतर्गत कंटिन्यूइंग वेटरनरी एजुकेशन प्रोग्राम का आयोजन किया जा रहा है, जो कि हम सबके लिए बहुत अच्छा है। और इसका जो विषय है वेटरनरी एक्यूपंक्चर एवं ट्रेडिशनल चाइनीज वेटरनरी मेडिसिन, इस विषय पर 3 वीक्स का जो ट्रेनिंग प्रोग्राम किया जा रहा है, ये वास्तव में बहुत अच्छा है और पशु चिकित्सकों के लिए देश के उनको तकनीकी विज्ञान को उच्चतम शिखर पर ले जाना एवं नई तकनीकी ज्ञान के लिए बहुत आवश्यक है। मैं कंपनी के MD डॉक्टर विशाल शर्मा का भी हृदय से अभिनंदन करता हूं कि हमारे बीच उन्होंने विश्व के प्रख्यात पशु चिकित्सक डॉक्टर स्टेरिन को आमंत्रित किया है मुख्य वक्ता के रूप में। मुझे लगता है कि देश के समस्त पशु चिकित्सक जो भी इस ट्रेनिंग में भाग लेंगे वो इसका लाभ लेंगे। आज के वर्तमान समय में ये बहुत बड़ी आवश्यकता है कि कंटिन्यूइंग वेटरनरी एजुकेशन प्रोग्राम हर स्तर पर चलाया जाना चाहिए। इसको सरकार की ओर से भी, वेटरनरी काउंसिल की ओर से भी, हमारे NGOs भी, एसोसिएशन भी, सभी लोग अगर इस पर फोकस करते हैं तो आने वाले समय में हम सब मिलके वेटरनरी प्रोफेशन को आगे ले जाने का काम करेंगे। और ऐसी हमारी संस्थाएं, ऐसी हमारी कंपनियां जो CSR मद में जो काम कर रही हैं, वेटरनरी काउंसिल ऑफ इंडिया की ओर से हम उनका हार्दिक अभिनंदन करते हैं कि हमारे पशु चिकित्सकों के तकनीकी ज्ञान को उच्चतम शिखर पर ले जाने के लिए एवं नई तकनीक, जो भी नई तकनीक आ रही है उनका ज्ञान उनको हो, जिससे पशुपालकों को भी लाभ मिलेगा। देश के अंदर वन हेल्थ एक बहुत बड़ा इस वक्त विषय है कि एनिमल हेल्थ, ह्यूमन हेल्थ, इन्वायरमेंट हेल्थ, सभी की हेल्थ जब ठीक होगी जब ही हमारा उद्देश्य पूरा होगा। इसमें इस प्रकार कंटिन्यूइंग वेटरनरी एजुकेशन के प्रोग्राम जो आयोजित किया जा रहा है, उससे मुझे लगता है हम जो वन हेल्थ का जो कंसेप्ट है और हमारे पशुपालन में जो दिन प्रतिदिन नई तकनीकी आ रही है, उसमें किसानों को, पशुपालकों को भी लाभ मिलेगा और वन हेल्थ का जो हमारा कंसेप्ट है उसको भी हम पूरा करेंगे। मुझे लगता है कि मैं पुनः ओरिहियल लाइफ साइंसेस कंपनी को एवं उनके MD डॉक्टर विशाल शर्मा जी को का पुनः अभिनंदन करता हूं वेटरनरी काउंसिल ऑफ इंडिया की ओर से कि आगे भी वो इस प्रकार के कार्यक्रम वेटरनियन के लिए आयोजित करेंगे तो मुझे हम सबको खुशी होगी और हम सब मिलके इस देश के अंदर पशु चिकित्सकों के तकनीकी ज्ञान को और उच्चतम शिखर पर ले जाने का काम करेंगे। बहुत बहुत धन्यवाद।
Okay, so good morning from France. So I'm Sterenn, I'm Dr. Sterenn Genewe, and we are doing the webinar about acupuncture and TCVM medicine. And today we start our second webinar. So we will talk about the principle to select acupoints, about the TCVM consultation, and also about how to use acupuncture in your daily practice. So let's start about the first lesson for today, principles to select acupoints. You remember that it's very important to find your correct TCVM pattern, because when you have this pattern, then it's easy to treat your patients. Because if you have like a deficiency pattern, then what you have to do, you have to tonify. In the contrary, if you have an excess pattern, then you have to sedate. In the same way, if you have a cold issue, too much cold, what you have to do, you will have to add some warm, like a warming method. And on the contrary, if you have too much heat in the body, then you will have to clear the heat. Something that may be a little bit more hard for you to understand, but it's also on the same philosophy. If you have like a prolapse in Chinese medicine, it's like something coming out, like a descending. Then you have to use an ascending method to balance this issue. And in case of vomiting, this is more like ascending, something going out, but from the top of the body. So in this case, you have to use a descending method. So if you have your basic TCVM, then it's quite logic what you have to do. But let me tell you which needle will be the first one that you will put in your patient. This is what we call the permission points. This is the first needle that you will put in your pets. So you have 2 options, and you can, of course, put the 2 needles together. a common mistake is to use only baihui, because baihui, we will see in a minute, it's located on the distal side on your pets. So of course, it's an easy location and you feel like safe to apply this needle. On the contrary, GB20, it's located on the top of the head of the pets. So you may feel less confident to put this needle at the beginning. And like sometimes you prefer to use only baihui. That's what I did, but now I'm using every day also GB20 because it's a great point, because either it's a permission point, but it's also a very good calming point. Meaning if you put this needle, you will leave for a while, for a few minutes, then your pets will feel more relaxed. And then you can put and add more needles in the body. So I think even if it's on the top of the head, don't be scared. It's a very well accepted point and it's a very useful one. So baihui, as I say, you remember we have like either the transpositional points that they are on the specific meridian, and you have what we call the classical points with Chinese names. So baihui, it's not on any specific channel, so it's like classical points, and it's on the dorsal midline. It's very useful for any hind leg issue also, and it's between the lumbar 7 and the first sacral, really on the dorsal midline. So you can put your finger on around the tail area and just go to the front, and then you will feel like a depression around your hip area on the dorsal midline, and this is baihui. So this is a very easy point to locate and very useful. GB20, as we just say, it's on the top of the head. It's in the depression on the dorsal midline, on a line drawn from the tip of the ear level with the center of the ear canal. So it's really in the middle from the ear. You can just draw a line, and on the dorsal midline. And it's a very useful calming point. So the best, it's you put the first two needles at baihui and GB20. Here it's the location on the pet. So here in the cat, and they feel really relaxed with this needle. When you first apply these two needles, then you go and you can choose what we call the local point. This is the point located near your complaint. Like let's say if you have an issue around the eyes, this is the point that you have to apply. So here I listed for you all the useful points accordingly to the location of the pattern, okay? So don't worry, during all the classes and the session, we will check most of this point and see the exact location. So this is just for all your information. You can refer to these slides if you want to check your local point. For example, here also I put for your reference, like all the local point near the eyes, sorry, on the top, and on the bottom you have all the points near the ear. So you can see it's already lots of options. So obviously you don't have to put needle in all these points. You can choose just a few of them. In the same thing, you have what we call the distal point. In this case, it's the point far from the complaint. Like if you have an issue like near the eyes, you can put a needle around this area, and then you have to put a needle far away from the complaint, so maybe on the back side or the back legs. Then you have again this notion of balance. So should we use any point far away from the complaint? No, the best is to use a point based on the pathway of the channel. Like if you use a point, like let's say on a specific channel as a local point, then your distal point will be located on the same channel. Here again, I've listed all the distal points accordingly to the location of your main complaint, okay? So this is again for your reference. And this is an example like for this puppy, he has an issue with the eyes. So you can use as a local point GB1. So it's on the governal bladder vessel, channel. So this is on the lateral side of the eyes. And then we have to use a distal point. So we can use GB37. It's on the same channel, the GB channel, but it's, you see, far away from the complaint, far from the eyes. It's located on the back leg. So we have the balance. Then we have all these very useful points, which are called the symptomatic points. Again, here I've listed all of them. Like if you have any fever cases, you can use these points. But don't worry, we will see this one in a while with the last class of today, when we will check how we can use acupuncture in the daily practice. We will check almost all of these points and see exactly the effect and also the correct location. But these are very useful points. So of course, if you have some issue like with the constipation, then you have to use this point. But again, the first one that you will apply will be the permission points. Of course, we have what we call combination of points. Again, everything should be balanced. Like if I put a point on the front, then I have to put a point at the back. If I put one on the left side, then I put one on the right side, if I can. Of course, sometimes the pets sit on one side and you cannot check the other one. So it's no worries. It's not like you have to balance every point. But at the end, you should have like a needle almost everywhere. Of course, if you have a problem at the hip area, you will have most of your needle at the back side. But still, you will have few needles on the front of the pets because everything has to be balanced. Like if you put some on the back, you have to put also some in the abdomen. So everything should be balanced. And we have now all the special points. It's a lot of specific points. Of course, we cannot go through all of them because some are like quite difficult to understand, but we will look like the most important one, the one that you can start using. So first we have what we call the master points. The master point, they are related to the anatomy, meaning if you have any complaint, any issue around the face or the mouth, then you have to use this master point, which is large intestine 4. The same idea, lung 7, so located on the lung meridian. It's the master point for any issue located in the head or in the neck. Same, PC6, pericardium 6, it's on the front leg and it's the master point from the chest and the cranial abdomen. Bladder 40, which we will learn later, it's located in the central of the poplite at the back side, at the back leg. Oops, sorry. I went too fast. It's the master point of the back and the hip. So this will be, you will see, a very useful point because any issue with the back side, you can put this needle and it's an easy point to locate. Stomach 36 is also maybe one of the most powerful points. And we will see later that it's very good for any Qi deficiency, for the immune system, but it's also the master point for any issue located in the gastrointestinal tract or in the abdomen. So any cases that are facing like some anorexia or like diarrhea or vomiting issue or pain in the abdomen, then you can put this needle, stomach 36. And the last one is spleen 6, located on the medial face of the back leg. And this is the master point for the caudal abdomen and the urogenital. So these master points are very useful because they are related to the anatomy, where you locate the complaint. On the same idea, but this is a little bit harder to understand, we have what we call the 10 influential points. So this one, they are not really related to the area of the complaint, but more about the function. So this, they are maybe a little bit harder to understand, but you can just keep in mind, like, for example, this one, bladder 11, because bladder 11 is more related to the bone. So any bone issue, you can always put this bladder 11. Or you have bladder 12, which is influential point for the wind. And we will see later that the wind is related to any epilepsy issue or any scratching issue. It's like the wind that is coming in your body, and then it's causing the seizure or the itchy of the pets. So this bladder 11, you can keep in mind, and bladder 12, you can keep in mind. But I guess the master point will be more useful for you. And now we come to the back shoe and front move points. These are the most important one, the one that you will really be able to use on your daily basis. because the back shoe points, this one, they are located on the back. The front move are also very useful, but they are located in the abdomen. So of course, the location is not so easy. It's easier, let's say, to go on to work with the back shoe points. They are very useful points, either for the diagnosis and also for the treatment of the internal Dangfu organ. You remember when we have our TCVM pattern, we are looking where we have the disease, where we have the imbalance. Then usually it's in an internal organ. And then we have points located on the back side. So here you have just a picture of the bladder because they are all on the bladder meridian, so on the back side. And each point is associated with a TCVM organ. So it's very useful, like to diagnose, to see where is located the issue. You can just put your two fingers around the dorsal midline because all these points, they are located just lateral to the dorsal midline. So it's always a couple of points. Like bladder 13, it's 2 points, one each side of the dorsal midline on a specific area. So when you just check your dog, you just put your finger around the dorsal midline and then you can feel sometimes a depression. Then we know there is a depression in this point. I check which point is it. Let's say maybe it's around bladder 15. It's related to the heart. So maybe this dog may have some issue with the heart. So maybe I can check and do an auscultation of his heart. So it can give you information where you have the imbalance in the body. And then, of course, if your diagnosis was, for example, a kidney deficiency, then you know you have an imbalance in your kidney. So you check kidney is related to this back shoe point, bladder 23. So, of course, you will have to put the needle in this point because it will be like the most important point for this issue, for this dog. So this point, they are very easy because once again, they are located on the dorsal midline. And let's take the example of bladder 23 to understand. So bladder 33, it's on the bladder meridian and it's the back shoe point for the kidney. So the specific location, as I say, it's on the dorsal midline. So it's 1.5 kun lateral to the caudal border of the dorsal spinous process of the second lumbar vertebra. So 1.5 kun, you may say, how much is it? So in this case, the 1 kun equals the width of the last rib. So you just check your last rib, and this is 1 kun. So you see 1.5 kun is like not so far from the dorsal midline. Usually it's like around one or two finger. So you know approximately where is it. So it's just lateral to the dorsal midline. And there is a tip to find your bladder 33 because it's a point that you will use a lot. So either you count your lumbar vertebra and then you check it's between the second and the third vertebra, lumbar vertebra, or what you can do is you can find your last rib on your pets. And when you find the last rib, you just draw a straight line to the dorsal midline, straight. And then you have the exact location of bladder 23. So here again, it's just like a picture. So you can see bladder 33, you can see 23, sorry. You can see approximately where is it in the body. And of course, it's 1 point each side. So this is 1 point, but on the other side of the dorsal midline, you have the other one. It's always a couple of points. And these points are very well accepted by the pets because they are on the dorsal midline. And usually they have muscle protection, so it's not painful for them. And it's an easy location for you to attend. Then on the same ID, you have bladder 23 that you will use a lot because for any issue with the bone, any issue with the kidney, and then bladder 21, it's the back shoe point for the stomach, and bladder 20 for the spleen. So this couple, bladder 20, bladder 21, it's also very useful point because you can use this for any problem in the gastrointestinal tract. So either anorexia, vomiting, diarrhea, pain in the abdomen, anything related to your spleen. So this one, it's also quite an easy location. it's 1.5 kun lateral to the caudal border of the spinous process of the 13 thoracic vertebra. And again, a tip to find this one faster. This time, you remember for bladder 23, you check to find the last rib and you draw a straight line. But for bladder 21, you follow the last rib directly on the top, and then you have your direct location for bladder 21. So this is just some tips. Either you have to count your thoracic vertebra, or if it's faster, you can just check, follow your last rib, follow it, and then you have the exact location of bladder 21. Again, this is just the picture, so you can see 23, and then you have like one space, it's bladder 22, and then you have bladder 21. So here again, just an idea to show you, like this is the cat. On the right side, it's the bottom. So you have by way, you see in the middle, and then you go on the left side, and then you have your bladder 20 and bladder 21, just to give you an idea. So you know that the first needle that you will apply will be your permission needle, by way and GB20 top of the head. Then you can put like the local point around the complaint. Then you can put some points far away from your complaint. Then, of course, you have to use your master points, depending where is located the complaint. And then you can use your master points, depending on which TCVM organ is involved. And then if you have the full TCVM pattern, then you remember you have either, to make it simple, a Qi deficiency, a Yin deficiency, same in the quiz that we did before, or like a Yang deficiency. And then you can add some extra point to really like treat your pattern. And if you do that, you will really see like a difference. You will really go further and really treat the diagnostic, not just do like the cookbook method. So just to remind you, like if you have a Qi deficiency, usually your pet is like very tired. He has like some exercise intolerance. He's very weak. He has some like function issue. Either he has like anorexia, or he's having like diarrhea, or if he is having like some dyspnea issue. In case of Yin deficiency, you remember, in this case, the dogs or the pets is like cool seeking, is looking for cold area. This is the dog who is like sleeping on the bed, but every night after a while, he goes on the floor because like he feels too hot. Or the dogs who always wants to stay outside even at night because inside it feels too hot. You can have some fever, but usually then it will be a low fever grade. The skin can be dry, it can be like painting quite often. And you remember the red color will be red, the tongue color will be red, and the pulse will be weak, but it will be weaker at the left side because the pulse at the left side is more yin and the pulse at the right side is more qi or yang. On the contrary, the yang deficiency pets will be like the pets who is having a qi deficiency, so a general fatigue, very tired, very weak, but he also has some cold sign, like his back feels very cold, his hair is very cold, he's shivering. So then you have what we call a yang deficiency. So in case of qi deficiency, this is the 3 points that you can add to your treatment. So we have stomach 36. So you remember, I told you on stomach 36, it's a very important point because it's already the master point for the gastrointestinal tract and the abdomen. And it's also a very useful point for any qi deficiency. And we have his friend on the front leg, which is large intestine 10. And then we have our last one, GV14 on the dorsal midline. So now we will check the exact location of these 3 points because they are very useful. Because in almost any case, you have like a dog who is very tired, very sick, very weak, then you can use this point because for sure they will have a lack of qi. And these points are very good like to tonify the qi and tonify like the energy in the body. So stomach 36, it's a point that you may use for almost all your patients. It's really a booster of the immune system. So it's a very useful one. So stomach 36, so it's 3 cone distal to stomach 35. Well, it's not very useful, but it's half cone lateral to the cranial crest of the tibia in the belly of the cranial tibialis muscle. So in fact, you have to find your tibial crest, and it's just a little bit lateral. So it's on the back leg, on the lateral side, just lateral to the tibial crest. And it's quite a long point. So you can point your needle. It's like a longitudinal point. So no worries if you are not in the exact location. You can just put your needle and going through the distal, like through the end of your leg. And you can just put your needle in, and then you will boost your immune system. You will boost your chi. And again, you remember, it's also the master point for the gastrointestinal tract. Large intestine 10 is his friend on the front leg. You remember, always balance. So you put this stomach 36, back side, back leg. Then you can use the same one, almost, large intestine 10, which is in the front leg. And it's 1/6 of the distance between the elbow and the carpus. Again, it's on the lateral side of the front leg. So here you have on this image the location of large intestine 10 on the lateral side, front leg. Here it's the picture on the real dog of stomach 36. So you see it's like on the lateral face, and it's like a longitudinal point. And you can put your needle going through the foot, okay? And this is like a very useful point. Of course, if you put one side, you can put also from the other leg, like the 2 legs. Again, if today the pet is very weak and it can sit on one side and you cannot go to this point, no worries. Maybe you can use the right side on the front leg. So it's always better if you can do both sides, but if you can only have access to one leg, it's still, like we can say, better than nothing. So no worries. It's not like I really need to do one on each limb. So this is more like for the chi. Then if you are sure about your diagnostic and you find like a yin deficiency, then you can use this 3 point, kidney 3, spleen 6, and kidney 23. So kidney 3, in this case, we are on the medial face at the back leg, but medial side. So kidney 3, it's in the thin fleshy tissue between the medial malleolus and calcaneus level with the tip of the medial malleolus. So here on the picture, you can see. So in fact, it's between like the medial malleolus and the calcaneus level. You have like the skin, and sometimes you can even like go through, like even put your needle through the skin and going out. It's a really useful point. And then we have his friend, spleen 6. Still, we are again on the medial side of the back leg. It's 3 cone proximal to the tip of the medial malleolus in a small depression on the caudal border of the tibia. So it's a little bit higher than kidney 3, but still it's on the medial side of the back leg. So you have kidney 3 a little bit down, and then 3 cone higher, you have almost spleen 6. So here it's the picture on the real dog, and there is a tip like this. As I say, it's on the medial side. Sometimes it's difficult to access to this medial side because either they sleep and it's not easy for you, or it's harder to see the point on the medial side. It's still no worries if you put the point at the same location but on the lateral side. You remember for kidney 3, I say sometimes you can even go through the skin and just take your needle out from the other side. So you see, if I put from one side to the other, it's okay. It will still stimulate my point. If spleen 6, it's too difficult for you to go through the medial, you can use the same point but on the lateral side. It will still have an effect. Of course, it's better if you can do directly from the medial side, but if it's like too difficult for you, it's still better to do it from the lateral side than to put no needle at all, okay? So don't worry, we always have a solution, okay? In case of young deficiency, so you remember in this case, the dog will be very weak. So of course you can still put your stomach 36, large intestine 10 to boost his immune system. And then you have to add this point to add some heat because this pet is feeling very cold. His back is very cold, he's shivering a lot. So we have to add some heat. And then for this purpose, we can use this GV4, GV3, and Baihui. And you remember, we can also use in this specific case, we can use like the moxa stick. We can burn the stick over this needle to even add more heat. So by way, you remember it's also our permission point. So you remember the location, the big depression when you go from the tail, you go to the head on the dorsal midline, and you have this point. Then GV3, it's also located on the dorsal midline. So it's not like you remember our bladder, our points on the bladder channel, it's dorsal midline, but lateral to the dorsal midline. This GV3, it's really on the dorsal midline. And GV3, it's in fact 3 points. So you have to put 3 needles because it's 3 points located between the dorsal processes of the lumbar 4 and lumbar 5. Then you go further, lumbar 5, 6, and then lumbar 6 and 7. So it's 3 points. And on the same idea, you have GV4, same on the dorsal midline, but this one is located between the dorsal processes of lumbar 2 and lumbar 3. So if you remember, on the lateral side of lumbar 2 and lumbar 3, we have bladder 23, the back shoe point for the kidney. And then on the middle, between lumbar 2 and 3, we have GV4, which is very useful if you have like a young deficiency, if you need to add heat to your pets. And then you can burn the moxa stick over this GV4. So you see that it can be quite a lot number of points. So usually how many points you will put? It depends. Of course, if you have a pet which is very, very weak, very tired, don't use too many points because it will be too much stimulation for him. One point, just a very small number of points, it's not very common. So the average, the middle number, usually it's 6 to 10 points. You remember most of the points, they are like 2 points, in fact, because you have one on the one leg, one on the other one. Like the bladder is always a couple of points. So you see, even if you use 10 points, at the end is around 20 needles. So this is the most common cases. Like don't use like 100 points, don't use 1. Again, everything is always a question of balance. The duration, how long should I leave the needle on my pets? Usually it's between, I will say 10 to 30, but it's the average, it's 15 to 20 minutes. Because of course they have to stay, they have to remain on the table, they have to keep the needle during this time. So of course, usually after 20 minutes, it starts to be a long time for them and they don't have the patience to wait for more than 20 minutes. So I think it's a really good time. You remember the preparation, it's very important. You have to be like relaxed. You have to know where is your point. Your pet has to be relaxed also. The owner also has to be relaxed and he has to understand again that he needs several treatments. Like one session will help his pets, but if you want to go further, he has to come back. Just be careful if your patient is very weak, very tired, or if he's pregnant. You remember also don't apply needles directly in the skin infection or in the tumor. And sometimes a healing crisis can occur, meaning that after the session, like the evening on that day, the pets can be like really, really tired, like really weak, but then the next day it will recover and will gain a lot of energy. So this sometimes can occur, but it's nothing to worry. And of course, if you have your Western diagnosis, it's always better because it can help you to find also your TCVM exam, your TCVM diagnosis. If you use the Electro Acupuncture, once again, there is only one case that you should not use this one. It's in the epileptic dog or if the dog is having some seizure, don't use this one. And you remember, if you use the electroacupuncture, we can use it with two different frequencies. Here again, it's the picture of the machine. So you have the frequency 1 and the frequency 2. Usually 10 minutes I use only first frequency, and then for the 10 more minutes I use F2, which will be in this case higher than the first frequency, to reach my TCVM organ, like to have a stimulation deeper in the body and also longer in time. You remember, sometimes if it's like a huge depression, we can directly inject something in the point, and usually it's the B12. So in conclusion to this first lesson, you know that there is a lot of options. You can choose like many points, and also the thing, it's like the point can differ. Like maybe I have my favorite points, and maybe the one I will use can be a little bit different from the one you use. Of course, some has to be the same. Like if you have an issue in the kidney, or if you have dogs with a hip problem, it's related to the bone. So of course, I will need the backshoe point for the kidney, the bladder 23. But then maybe the local point may differ, or maybe it's a yin deficiency and you feel more confident with spleen 6. I feel more confident with kidney 3. So it's really depending. It's an individual medicine, meaning that two dogs with the same Western diagnosis may have a different TCVM diagnosis, and then the treatment will be different. And also it's an individual medicine from the practitioner. Like some doctors, they use more this point, or some, you see, I told you like the special point. I just explained you like the basic one, like the master point, like the backshoe point, but we have other special point that you may use or not. So just remember, like the special point that you have to use right now, it's the backshoe point, because they are very easy. They are very well tolerated because located on the backside. So it's easy for you to find the point. It's the pets usually have no issue with this needle, and they have a great power because you can sometimes just find the depression. So you know that there is an imbalance in this place. So just put a needle, even if it's not on your TCVM exam. You are seeing the dog, let's say, for some kidney failure. So of course you put your bladder 23. You do all your points related to this pattern, but maybe just when you check your pets, you feel like a depression in the bladder 17 related to the heart. And then maybe he has no issue, but still you feel the depression. Just put 2 more needles here, because maybe he has no issue now, but maybe his heart is a little bit weak and he may have some issue later. So it's still better, you feel a depression, just add these two needles. So it's backshoe point are very useful for that. So now this was the first one to give you an idea about how to select your acupoints. And I don't know if you already get, like there is a booklet that you will, or you may have received already, with the description again of all the most important points. Huh? So don't worry about the location, you may have this booklet.